This is a brief discussion of outputs in evaluation and what they really tell us. So an output is a quantitative measure of a product that comes out of our program. So just a brief example, let's say you have a program to help reduce the likelihood that individuals will have a second cardiac incident. So these are people that have been identified as having cardiac issues, and your program is going to teach skills such as nutrition, fitness, stress reduction to help this population. And so just briefly, your inputs are all those things that would go into the program in order for it to run. So funding, staff, equipment, and you would list those all here. And keep in mind, this is a very simple logic model. There are many complex ones that you can do and have different designs, and they're getting quite fancy now. The activities are all those things that are going to happen in your program, like fitness classes, educational sessions, perhaps some coaching. And the outputs is what we're looking at today. And the outputs are the numbers that come out of these activities. So I might say that we had 254 people register, and we had 35 educational sessions. So just straight numbers. They don't tell us anything beyond the numbers. And then I might say we had 46 fitness classes and 249 supportive phone calls or coaching phone calls. So you're going to keep listing all those. Now that's sort of the easy part, but then we want to also in these outputs dig down a bit deeper. So I might have had 254 register, but I also might want to look at and should look at, of those who registered, how many people actually showed up. So I might have 94% completed one or more session, or completed at least one session. I would probably break down from there how many completed all sessions. So maybe I have 59% completed all sessions. I might want to break it down by educational sessions and fitness sessions, because maybe what you're going to find in some of these short-term outcomes is some people really benefited from the educational sessions and made improvements to, let's say, their nutrition, but maybe they didn't make any big gains from the fitness because maybe they don't like engaging in fitness activities, and so they weren't able to change that behavior. So we want to try to get these numbers as detailed as possible, because when it comes to the short-term outcomes and the medium-term outcomes and the long-term outcomes, but particularly these two, as grants often don't allow enough time to get to long-term outcomes, we want to be able to break down groups. So if I look at this, I would probably divide the participants who participated in the program into those who had a low dose of the program, medium, and a high dose of the program, because I'm guessing you're going to find different outcomes. Probably ideally stronger for those who attended more of the program. But on the other hand, what if you had no differences? Maybe it doesn't make a difference whether they participated in a little bit of the program or a lot. Then I want to understand why that is so. So maybe I find that those who participated in a small amount of the program also had, for some reason, more access to another complementary program. And so that really helped them. So we want to kind of rule out if there was other reasons why people did make gains or didn't make gains. So there's a lot more to discuss in interpreting results, but I just wanted to today really just get at the outputs. And so to set yourself up to get good outputs, you really need good tracking systems and as much detail as possible. And think at the very beginning, think about what you want to look at here, because once you get to looking at the outcomes, if you didn't collect the data here, it can be the data like in the outputs here, it can be very hard to go back and reconstruct all your numbers. So spend a lot of time here, because that's going to be so helpful when you try to understand these. And that's it. Have a great day.